Hi, my name's Greg Felt. I'm Director of Public Health for Sheffield. This is this week's situation report dated today, the 19th of January. Numbers are dropping pretty much nationally now. Certainly they're dropping in the southeast of England. It's fair to say the numbers of people going into London hospitals have stabilised, gently drifting up a bit. It's important we reflect on the national, and the key point is that what we're seeing nationally with regard to the epidemiology gives us more confidence that the tier 4 measures are sufficient to hold the variant virus in check. They may not be sufficient to make it go away completely, but they're certainly sufficient to hold it in check. Then onto local epidemiology. Our naught is between 1.2 1.3. That's a Yorkshire measure as opposed to a Sheffield measure. I expect that will come down as the lockdown bites. We're a couple of weeks into that now, and I expect that will come down. Rates, a 7-day rate is beginning to come down. The post-Christmas peak was 7-day rate was close to 300 per 100,000 population. That's definitely on the turn. It's certainly plateaued. It's beginning to come down. It's probably closer to 250 per 100,000 at the moment. Positivity is starting to come down. Looking underneath that, it's the early working age population where most of the growth still is. The infection rates are higher in the working age population. That reflects travel and work patterns. It also reflects that the elderly are far less mobile and taking a lot more care. And the incidence reflects that. Rates are beginning to come down now in the over 60s, which is clearly good news, because that's the group that we worry most about. There's a significant proportion of all cases in Sheffield are the new variant, and we all know that's significantly more transmissible. The control interventions are just the same, but we need to take a lot more care because it's more transmissible. Hospitals remain busy, no two ways about that. The wriggle room for the availability of spare space in hospitals is slim to zero. The hospitals across South Yorkshire are under sustained pressure, and I think we're acting with that in mind. A significant proportion of beds in Sheffield Teaching Hospital have someone with COVID in them, and that is having an impact on other work. So we're taking a great deal of care. The basic messages that we are in a precarious position certainly haven't changed. All up epidemiology, our rate up till the end of last week is beginning to plateau, beginning to come down. We'll soon be close to where we were just in the run up to Christmas, which is better than it has been over the past 2 or 3 weeks. But as I said before Christmas, although our rates are much lower than most of the rest of the country, that's clearly good news for us. They're still too high for comfort, far too high for comfort. People consistently ask me, when will it end? And the short answer is I don't know. It's impossible to predict how the rest of the pandemic will play out. The story to date is it's very unpredictable and it can change very quickly. But rough guess, my estimate is the next 2 weeks will be probably the worst of it. I think it will be really tough for the next 6 to 8 weeks as a very minimum. Still, lots of people in Sheffield and broadly across the country are becoming infected. Some of those will get sick. Some of those who get sick will be really sick and end up in hospital, and some of them will sadly die. And that is something that we can do something about. You know the score, the same set of rules continue to apply. Get a test if you have symptoms, wash your hands, keep your distance, wear a face covering, and be careful who you meet with. The national lockdown is definitely having an impact. There's no two ways about that. It's impossible for me to predict when that will end. What's really driving the pandemic is community transmission. There are outbreaks in various settings, care homes, some hospital wards, and that's the case up and down the country. They tend to be fairly contained. What's really driving the pandemic is community transmission, households to household mixing. That's the real thing that we need to get on top of here. And that's been the case from the start and will be the case to the end. So next few months, there's variant in Sheffield. A significant proportion of the cases that are diagnosed are of the new variant. So my sense is some form of restrictions are going to be needed for some time. We've seen in other parts of the country that when the variant takes off, it takes off really, really quickly. Fortunately, that hasn't happened in Sheffield. Maybe we got lucky with regard to the timing of the lockdown, but we haven't seen the really steep rise that other parts of the country have seen, and the harm that comes from that. So possible that we got lucky. It's possible that we're also doing the right thing as well. Long may that continue. So we will be in a position of some perilousness for quite some time, because we've seen how quickly this can take off. The thing I worry most about is household to household mixing. That's where most of the spread is going to be, and if we keep a lid on that, then we keep a lid on the spread of the new variant, and the control measures remain just the same. My sense is mid-February is when the tide will start to turn. There'll be enough people vaccinated by then. The effect of the lockdown will clearly have played into that by then. And the turn of the seasons, more time will be spent outdoors, and the risk of transmission is much, much less outdoors than it is indoors because of circulating air. I don't think we'll see much significant improvement until spring, but as I say, the tide will start to turn. My sense is mid to end February. It's very uncertain, and I can't be in any position to promise anything. But new strains will emerge, and the B117 strain has been clearly a shot across our bows. The reality is COVID will be here in some way, shape or form, certainly for the rest of this year. Where next? Vaccines are clearly part of the answer. Credit to everybody in Sheffield who has pulled out all the stops to vaccinate significant numbers of people really, really quickly. We don't know if vaccines reduce transmission. There's still a possibility that people will acquire the virus and carry it with a low level of symptoms and thus still be able to transmit it. We don't know that. What we do know is that vaccines reduce risk of serious illness and death, particularly in the very elderly, and clearly that's great news, but we don't know if they reduce transmission. So I think it will take us a long time to, one, fully vaccinate the whole population. Secondly, because we don't know that vaccines reduce transmission, I think we will be in a space where we need to take care and we need to learn to live with COVID for quite some considerable time to come. There's a real risk that if COVID is allowed to circulate freely in a population which is mostly not vaccinated, it will have a bigger chance and more opportunity to mutate, as we're seeing now. And clearly that's bad news. If mutations lead to vaccine resistance, then even the vaccinated won't be protected. So we clearly need to be careful, and we cannot let the virus circulate unchecked in the unvaccinated population. So the solution is clearly to vaccinate as many people as quickly as possible. That gives the virus nowhere to go. But even then, the caveat is we're not sure whether the virus will mutate in the future. So last point. The rules. A lot of people are grumbling in my inbox about nobody's obeying the rules and the interventions aren't working. Really clear, the interventions are working. Sheffield has fairly low numbers actually compared to comparing nationally. That it's not working gives a misleading narrative that suggests that the public health measures don't work. They do work. However, this is an exceptionally transmissible virus, and lapses are quite easy. The truth is, some of us don't stick with the programme long enough. Some of the truth is there are occasional lapses. Some of it is it's really, really easy to spread. To give you an example of why they work, there is almost zero flu in circulation this year, and that's at a time where we've got good vaccinations and we're all washing our hands, keeping our distance, etc. So what we are doing is working. There are constant news reports of people breaching the guidance and not obeying the rules. The reality is really different. We hear consistently from published evidence in all sorts of places, and actually from the police and our environmental health officers whose boots are on the ground. Their view is most people are obeying the rules, and thank you for doing it, because that really, really makes a difference. So please keep doing it. The movement data also backs up the notion that people are obeying the rules. The rules are complex. They keep changing. I think someone calculated last week there have been 350 changes of rules since March. It's impossible to keep up with them. our approach in Sheffield has always been getting to the underlying principles. The stuff that doesn't change. If you have symptoms, get tested and isolate. If it could always be regularly washing your hands, keeping your distance from others, limiting the number of social contacts you have, and wearing a face covering outside, and being careful about ventilation inside. So all of those things are not going to change, and your consent and your willingness to do that, one, has made a difference, and two, will continue to make a difference. The two key areas that are of concern, one is the between household mixing, and the whether you call it the rule of six, bubbles, or anything else, the more individuals that you mix with, the more opportunity there is for the virus to spread through different populations. And secondly is isolation. It's a critical issue for low pay, or people on low pay and insecure work, and the government clearly have clocked that they need to do more to address those issues. So thank you for continuing to keep with the rules and stick with the programme, because your collective efforts really have made a difference.